So this has been addressed with this kind of machines. We have the adaptive therapy, which is the form of treatment as of now in the field of radiation oncology. And this can be done with two different kinds of machines. One is a CT-based machine, and MR Linac is much higher. And the reason why we prefer MR is the reason that the soft tissue delineation and all are much, much more better to see on a MR compared to a normal CT scan. So this is the setup of a patient. Once the patient is set up on the machine, what we have to do is we have to take a scan for that day, because we don't know how much of the bladder is there, how much of rectal gas is there and all. There'll be a lot of internal changes in the anatomy of the patient for that particular day. So we take the scan. That is a fast scan. It takes around 5 to 6 minutes for the scan to be done. It's not a conventional diagnostic MRI which takes half an hour, 40 minutes or 1 hour. So it is only a 5-minute scan. Once the scan is done, we have to do a proper segmentation of all the structures wherever we require to treat. Suppose this is a case of prostate. We can see that the prostate has been delineated, and then we give a very minimal possible safety margin into the surrounding normal structures, and this can be acceptable. But if it was a conventional kind of treatment on other machines, you would have been treated almost all half of the bladder there. So, and that might also lead to some amount of extension into the rectum also. Now that the margins have come down to this level, maximum 1 to 2 millimeters also we treat for some times. So once these margins have come down, there is no way that the initial plan will match with the whatever plan we have for that day. So we have to do a replanning and then retreat the patient for that particular day. So the conventional treatment was that you take up one plan and the whole course of radiation used to go off with that same kind of plan. But in adaptive therapy, every day we see the shape of the organs, we have to reshape them according to that anatomy of that particular day, and then do a replanning and then treat the patients. So how is this possible? I said initially it takes 2 days, but now we have only maximum we can spare the patient for half an hour on the machine. This is possible only because of this technology, and this time is very valuable for us, because once the patient is there on the machine, it has to be done as quickly as possible, and you have to release the patient from the treatment. So artificial intelligence is one area which has changed this kind of highly speed kind of planning and automatic contouring, which helps us in for delivering the treatment as early as possible. So we are doing a replanning and recontouring every day, so the side effects are very, very less for these patients. Also, not only about the normal structures or the critical structures here, during radiation we see that sometimes almost all 50-70% of the tumor reduction will be there. Suppose this is a cervical cancer, a locally advanced cervical cancer. At the end of the treatment, maybe at the 3rd week of the treatment, we see that almost all 70% of the tumor is gone. If you have to treat what was planned initially, will be invariably treating the normal structures there. It's not only the tumor which gets the treatment. So this is the adaptive treatment which helps us in helping the treatment. So suppose these are all prostate patients. These are all elderly patients. You see that in this patient there is a gas which is coming through the bowel here, through the rectum. And after some time, as it comes through the rectum, it will push the prostate anteriorly. So conventionally, if you have to treat these patients, we treat almost all this entire area. But now, since we are seeing the patient's treatment delivery also, so when the treatment delivery is happening, we are seeing the patient, and now we also have the CMM system, which is an automatic system. The moment the target goes out of our boundary, the treatment beam will be switched off immediately. So these kind of precise treatments are happening because of the AI which is empowered with this machine.